Welcome back. As a pediatrician, we have a whole room full of children and they're accompanied by mothers, but too often the obstetricians are just somewhere else entirely. In Oxnard, we have a very nice clinic, the Mandalay Bay Women and Children's Medical Group, and it's finally allowed us to share our concerns. Led by Dr. Bob Lefkowitz, he brought to us that one more thing that we needed to do on the exam that was really probably one of the major things that we can do. Looking at eyes and ears is fine, but we have to send all these children home to their mothers. So with me today is our Director of Obstetrics at the Ventura County Medical Center.
Good afternoon, Chris.
Good afternoon.
In 2007, as you said, we opened up the Mandalay Bay Clinic. And having the children and the mothers in the same place gave us another opportunity. There are so many areas of care that sometimes go overlooked, and I think one of the diagnoses that can have a tremendous impact on families and children is that of postpartum depression. It's a fairly large problem. The national studies through the National Institute of Health have shown that as many as 14.5% of women suffer from postpartum depression sometime during the first few months of the infant life. And of course, the focus on the mother's behavioral health is important for the mother's comfort and the enjoyment of life. But even more than that, the effect that the mother's behavior has on the infant's development. And there have been many studies to show that mothers who suffer from postpartum depression not only have problems themselves, but their babies have problems that can be long-term. There are even studies that go out many, many years showing that the children of a depressed parent can have lifelong problems, not only with growth and development and behavior and cognition, performance in school, but also later on with other kinds of diagnoses like drug abuse and alcohol use. So it's an important problem and something that we've decided to focus on at Mandalay.
Well, here we were talking a little earlier with this mother who took 72 foster care children, often who were just screaming from as they're being weaned from drugs, and just the feeling of a baby in your arms, and to have a mother who, because of her depression, just can't feel the joy of a baby in her arms. How do you go about finding that out in an obstetric visit? I mean, we don't think of that as being a question that you guys ask.
It's very an interesting question and a very, very good question. Mothers during the first couple of weeks generally have quite an adjustment to make, particularly first-time mothers who find that their own life patterns, their sleeping patterns are totally altered for 18 years or so, and they have to respond to an infant's needs beyond their own needs. And mothers who are having problems just coping with the day and their own feelings about themselves and their performance have difficulties responding appropriately to babies. And those first few months of mother and infant interaction are just so important to baby's development that a mother who can't perform those functions and be there for her infant can have long-term problems. Now, as far as identifying that, everybody has problems, but usually by around 2 weeks, most people have made the adaptation and have found a certain pattern to their life, which is certainly new, but acceptable. When we see mothers at 2 or 6 weeks, we'll frequently ask them how things are going, and you expect a certain amount of exhaustion and difficulty and frustration. But if you only ask the question, you frequently don't make the diagnosis. So in 1987, a group developed the Edinburgh Postnatal Depression Scale, and there are other depression scales that can be used. But the difference between using the scale or asking a question is really remarkable, and studies have shown that the prevalence or the occurrence, the frequency of postpartum depression can be as high as 8% if you screen with a tool like the Edinburgh. But if you're just really trying to be sensitive and asking a question, you only pick up the diagnosis about 1.5% to 2% of the time. So what we've done at Mandalay Bay is we've started using as a routine screening tool this Edinburgh Postnatal Depression Scale. So every woman that comes in for her 6-week visit, and what we're starting to do is women who come in with their babies at 2 weeks for the baby's visit will get the 10 questions of the Edinburgh Depression Scale. And those that score high are referred into behavioral health evaluation and counseling. We're currently developing a relationship with California Lutheran University. They have a master's program in counseling psychology with an emphasis on marriage and family therapy. And so the mothers who are then screened can have evaluation and counseling with a therapist who can then follow not only the mother and recommend treatment for the mother, but also follow the baby and look at the interaction between the mother and the baby, and hopefully follow then the development landmarks that we expect the babies to make, and make useful interventions that can have a tremendous impact on the family's life and health.
Well, there's your statistics. If we're only picking up 1 out of every 100 or 1 out of every 200 just by asking, among our many questions, how are you doing today, and it moves suddenly to 1 out of every 12, you've really gone out of your way to seek resources. You've been at this for really 2 years trying to get this program up and going, and there are screening.
There are a lot of people who are interested, a lot of people who want to help, but putting a program like this together takes a lot of talking, a lot of cajoling, and finally finding the people who are interested. We've had a great deal of help from the Ventura County Medical Resource Foundation, who gave us a grant to get some brochures printed and be able to hire Dr. Margaret Cortese, who's a psychologist who's been with Ventura County for a number of years, to do the evaluations. Our problem has been with long-term care and ongoing counseling, and meeting Dr. Chris Christian and finding that they had a need for patients and we had a need for service. And it was one of those fortunate relationships that has grown to the point that within the next several weeks, California Lutheran will have a community counseling center at Mandalay Bay, seeing patients and families between 2 and 4 evenings a week. So we're really very excited about that relationship starting.
It's hard as a society. Our mental health department, I think, has a hard enough time with the schizophrenics and the people who are severely mentally ill and kind of shunt off, not because they want to, but because of the resources that you need. If it's 1 out of every 12 women has this problem with maternal depression, and sometimes that's a question you don't want to ask. I think we've talked about that, is how are you getting the physicians to ask that question? We've had programs on fetal alcohol spectrum disorder, and suddenly one clinic will have absolutely no mothers taking drugs or alcohol during pregnancy, and well, it turns out it's quite a few more, and if we can intervene during pregnancy, it's a good thing, but it's taken probably going on 10 or 15 years to get them to ask those questions regularly. What kind of educational things are you doing for physicians?
As everybody knows, physicians are busy, and there are a lot of patients to see and a lot of services to give, and asking them to do one more thing can be difficult. I've gone to the clinics in our agency and spoke to them about postpartum depression and offered the screening test and education of the practitioners on the screening test, and we're getting a good response. People are, of course, interested in the outcomes and interested in the family's development and the family's health. And so it's a process. It takes a while, but the more that the patients see their improvement and get back to the doctors, I think that everybody's going to be enthusiastic about this new program.
Well, thank you so much for everything you've done, the dedication that you've put into this. Ventura, you've heard about a number of programs, programs to support children in foster care, programs to support grandparents who've suddenly had to take care of their grandchildren, and programs to really ask the question, is mother depressed? What can we do to help the child, help that family? And now through a partnership between Ventura County Healthcare Agency, the Behavioral Health, California Lutheran University, we're finally able to start to bring some resources to this problem. So Ventura, support the Ventura County Medical Resource Foundation, support California Lutheran University, support kids and families, and get out there and get moving.